Okay, hi everyone. I'm here with my good friend Randy Vawdry, who will be teaching a master class for us. And for people that are in the Kharrazian Institute or wanting to explore Kharrazian Institute courses, I try to bring in leading experts that are actually real clinicians that work with real patients and actually get great results. And Randy, has a phenomenal reputation. He's definitely an expert in the field, and he is one of the people that I'm so excited to bring to the Kharrazian Institute because there's these throughout the country there's these really talented clinicians not many people know about, but they're actually doing phenomenal work. So, and not only that, but you are a phenomenal educator. And I saw your course notes, and your course notes are amazing, and the topics you covered in them are so well put out, and the direction that you're taking people throughout the course just by looking at your course notes was so amazing. So, first of all, a lot of people may not know who you are or your background. So can you let us know a little bit about you and your practice and kind of things you're seeing in your office?
Yeah, thank you so much, Datis. What a compliment. And so excited to be able to share some of this education with Kharrazian Institute subscribers. My background is a nurse practitioner, and when I graduated, I instantly took a job as the director of a nursing home. And then that expanded to two nursing homes. So the first 10 years of my career, at least 2 or 3 days a week, I was rounding in nursing homes. And it's not the most exciting arena, but I tell you what, I learned complex medicine. I learned what happens with the ravages of diabetes and heart disease and COPD and so forth. And I had to become very familiar with those disease states. At the same time, about a year after graduation and while working in a nursing home, I purchased an urgent care and then expanded that urgent care model. And so in my area, I would spend half of my time in a nursing home taking care of chronic disease and half of my time in the urgent care taking care of acute issues. And so I had this really broad range of medicine. And over time, I grew dissatisfied with the outcomes. And I thought, my gosh, we really don't help make people better. And I want to share just a silly experience. I had a lady in the nursing home that yelled nonstop, "Help me, help me, help me." I tried every medicine, we could not figure it out. And one time with her daughter, I said to her, "I'm really sorry that I haven't been able to help make your mom any better." And her daughter says, "Yeah, I mean, if it was appropriate, I would just ask you to give her estrogen because I go crazy without my estrogen." And I thought, hey, I haven't tried estrogen. How would you feel if we gave your mom some estrogen in a nursing home? You don't do that in conventional medicine. That is frowned upon. And she's like, "Well, why wouldn't me? You have my permission. Let's try it." And I did that. I gave her some estradiol. And about 2 weeks later, I'm doing rounds, and the nurse says to me, "Hey, Randy, listen." And I'm looking around. I'm like, "I don't hear anything." And she says, "Exactly." She stopped yelling. And I was thought, what? She's what? I went and saw her. She's still confused. She still had dementia, but her demeanor and her interaction, everything about her was different and had changed. And the only thing that was different was we added a little hormone. That early experience in my life made me realize that sometimes the way conventional medicine rolls misses the point 100%. And so I've spent the last 10 years going to guys like you and going to the functional medicine group and the naturopaths and the chiropractors and the people who think outside of the box. I swear I've probably spent $50,000 in CME that my license won't pay for it, right? Because can only do category 1 PRA, but it has helped me understand how to take care of people. And so that's what I put together for Kharrazian Institute was kind of this framework, this thought process. Datis, you talk a lot about the web, and there is a very complex web for neurological health that I've tried to simplify and said, hey, here's your priority areas. You can't do everything with everybody, but you can certainly tap these priority areas and make them better. And in my experience, when you start tapping the priorities, people feel better and they do better. So it just depends on how early they're entering your practice and what their baseline history is. But I really believe we can change the way that people age and make them feel better. So that's what I'm bringing to Kharrazian Institute.
Yeah, and you know what I love about your information and the way you teach is the fact that you go right to the really core physiological mechanisms that really hit and have the biggest impact on people, and you make it so easy for people to understand. But not only that, the way you communicate the information is so effective for practitioners to also use with their own patient population to explain things. You know, you have this talent of explaining things so easy to practitioners, but it's the same language, I would guess, as you're speaking to your patients, right?
Yeah, you in my own practice currently, like I still am very much in the conventional world. I have a bunch of practitioners that I oversee and provide education for, and I'm involved in training. So uh, it's been it's been really hard because I've been forced to learn how to teach and learn how to relate, and I still see patients on a regular basis during the week. So I accept your compliment. I appreciate that, and very much a part of my rhythm each week is teaching practitioners how to look at a topic, maybe how to dissect it, how to talk with it to a patient so the patient feels comfortable with the testing or the trials and interventions, really instilling hope through that process. And so I
Yeah,
hope to bring that to this group.
right. And I think as an educator, and when I look at people learning, let's say functional medicine, people think, well, I just know the information. It's like that's not why you necessarily go to a conference or hear another clinician speak. Because yeah, there's information out there, but how it gets put together, how a person's thought process is, how that gets communicated to the patient is so much more valuable than just like random PowerPoint dump of facts, right? And I think that's attribute you're very, very, very good at. And I think even if people, felt like they totally understood the field of neurology and functional medicine, which, is vast and it's complex, but if people felt like they owned it, just to see how effectively and efficiently you put that information together, I mean, it's masterful. So with your patient population, I mean, what for people that are thinking about attending this course, what kind of patients would this information apply to? Because you have neurological disorders and neurodegenerative conditions, and what is the average patient population of a practitioner out there, and that you think would be a good candidate for this course?
Okay, excellent question. The easy answer is people with neurological disorders. But I
Yeah.
want to qualify that because there isn't a day that goes by that someone says, I'm foggy. I got brain fog. What causes my brain fog? And just the other day, I did a Google search and it says brain fog is basically a neurological problem, but we don't know how advanced it is. And I went to uptodate.com and looked at brain fog, and it talked about mild cognitive impairment, which is a precursor to Alzheimer's disease. You can't tell people that it's a precursor to Alzheimer's disease. So the first way I would answer your question is anyone who has some level of a neurological symptom, they need this approach. I view all types of neurological disorders from the same framework. So, for example, the psychiatrists are peddling neurotransmitters, and the neurologists are peddling medications for movement disorders and other complexities, right, in multiple sclerosis or whatever. And instead of peddling a medicine to do a certain thing, why don't practitioners just drill down to what's happening in the underpinnings of the brain? Because whether you say someone has depression or anxiety or brain fog or dementia, you're basically saying the brain isn't working very well. And most practitioners, in my experience, are kind of intimidated by the brain. They're like, I didn't really study neurology. It's too complex. I don't understand it. And they'll shy away from it and they'll instantly punt. And my response is, it's not really that hard. If you just kind of drill down to the underpinnings, how's blood flow? What's going on with systemic inflammation? What's going on with metabolic health? Because diabetes is a massive contributor of brain fog. And so if people have elevated blood sugars or elevated insulin on a regular basis, they're going to have brain fog. So my goal is to say, if you take care of patients, you're taking care of all of these people who have some form of a neurological symptom. And if you just had the framework underneath you, you could give the patient some guidance and say, hey, I think these 3 or 4 things are contributing. Let's address them and see if your brain fog gets better, or your memory gets better, or your anxiety gets better. I don't want to sound like a one size fits all, but it's only in conventional medicine that we've separated all these types of neurological symptoms under the pretense that they're different.
Yeah.
It's what part of the brain is affected is really predicting what symptom they're going to have.
I think that's a really good point. I just would like to add that, for most, as an educator, and I used to go all over the country teaching, and I'd meet different people, different cities, become friends, and then see them year to year doing the seminar circuit for a long part of my life. But I would see practitioners decline in health too. And to be quite honest, this course is really for every practitioner for themselves. Like, you really have to master how to maintain your brain function, because your brain function is going to basically determine how effective you are in your clinical practice and how long you're going to practice. And, just assuming that, well, if I'm just supporting my gut and taking my supplements and that's okay, it's not necessarily enough. You really have to understand the principles of brain and really think about that for yourself too. And for sure, your loved ones, right? You all have family members that are going to deal with some type of cognitive decline at some point, or just general brain function or memory issues, or depression or anxiety. It's very, very real. So I know I was a little biased, but I think the topic that you're teaching really applies to every single person. And if anything, the first person that really should think about taking this course is the practitioner, for their own health, for their own physiology, for their own brain. And then as they go through strategies to optimize their own brain function, it's just going to spill over into all the things that they can do with their patient population. So how did you structure your course? Like, how did you outline it? What was your thought process? What were you going through as you were putting together this 5-hour masterclass?
Yeah, this is awesome because I put triggers of neurological dysfunction in the middle, right? Any neurological, and it doesn't matter to me if we're talking about cognitive or motor issues, sensory issues, or behavioral health, mental health. And from there, I've said, here are the categories. So I really struggled with saying, what's the first priority? I initially, a couple of years ago, said this is vascular. And I actually shifted in this training and said, I think it's metabolic, because so much of our society is struggling with metabolic syndrome, right? And so it basically says, look at these metabolic factors. These are the tests that you would look at, and here's your goals. And then we go into vascular, and then we go into insufficiency syndromes, both hormones and nutrient insufficiencies, gut health. Gut health is so important. Everyone talks about the gut to brain connection, but if the only thing we do is throw probiotics at people, we're missing elements. So there's so much that could be done. And then there's a whole bunch of other areas. So I've kind of structured it to say, here's your priorities, and then here are other areas to look at. And I've tried to make it super clinical and applicable. Instead of just talking about like research studies with tests that no one does, right? Here are the tests that you could do. Here's the reference ranges that I use. Here's why I use them. And here's the expectation when people do that. Here's what people would say. And so that's the framework. I've tried to be very clinical, very applicable, something that could be done in a small single provider office to really strengthen their clients.
Yeah, and I think for me, looking at your materials, it's so amazing the way you did it. And I think one of the key takeaways is the concept of taking that's something that's so complex and difficult, and then simplifying it into like a roadmap, and even a step-by-step approach where you look at these clinical priorities and decide, what approach to take. Now, with your course content and the way you structured it, what do you think would be some difficulties people may have with the course, or what have you done to mitigate that with some of these more complex concepts?
The first thing that is a potential challenge is just how many variables there can be, right? Sometimes clinicians and patients at the onset feel overwhelmed. They're like, oh my gosh, there's so much here. And so the way I've mitigated that is I took it in bite-sized pieces. When we recorded these, we recorded them in 15, 20-minute sections. So I'm like, here's the vascular component. Here are the things that you look at and test for, and here's why. So that you very easily could go into that course and say, I want to remember what Randy said about metabolic syndrome. That's this course, and my only focus is metabolic stuff. When he talks about micronutrient deficiencies or hormone insufficiencies, those are their own separate little lectures that you can click on. So the easiest thing to do is, when people feel overwhelmed, I've tried to separate each of the recordings so it makes it super doable to go back and review the literature and review the discussions about how to do this.
Yeah. And I think as a person like yourself, you've been through so many seminars yourself and continuing education hours, as we're all on our journey to expand our growth, and then you can kind of see how, you know, how to structure things so people can learn. What part of your course, what percentage of your course would you say is like direct application, what you actually do in your practice? I mean, and how much of it is background information?
Oh my gosh, it's all direct application. I worked, uh, Datis, we had a time frame. We can't give 3 days of lecture. We have to really condense this in a period of what people could use. So, I mean, you have to give some evidence. I try to list the evidence that I'm referencing in there, but I don't spend a lot of time going through the weights of the studies and all the meta-analysis. It's really basically, hey, look, you want to correct these vascular issues. Here's kind of a roadmap about how to do that. Here's what you test for. Here's your parameters, and away we go. So um, I've never really quantified how much of it is just kind of science versus direct application, but I've tried to make it super applicable to practitioners.
So I know I remember the first slide deck you sent in. I'm like, Randy, this is way too much.
Right.
You have to cut it. Just get to the core. You know,
I know, right? I spent a lot of time whittling down, whittling down, whittling down, and it made me ask the question, okay, when people walk away from this, what do they got to know? If I got 20 minutes, what are the salient points? So that's really where I've tried to drill down and make this super useful for a practitioner. And you said it at the onset. Um, I love education and I love to teach, but I see patients 3 days a week,
yeah,
right? I'm in between patient consults right now. And so I'm still very much in the fight. I'm very much in the hunt. I'm constantly trying to figure out, okay, that went over my patient's head. I have to make this a little bit simpler. And the reality is, sometimes it's hard to make something simple for someone with neurological problems, right? They don't capture very much. It depends on how advanced they are. So, really, the message is I loved what you said. Practitioners, take care of yourself. Work really hard to say, hey, I'm going to do these interventions. I've given really concrete examples. Try this. I would encourage you to do it. Spend $100, try a couple of the things that I've talked about, take a test, do the intervention, and retake the test. You'll find these interventions, they're very applicable. They work. They'll help you do better.
right. What percent of would you say your course strategies or like conventional medicine versus like functional medicine versus lifestyle medicine, as you are looking at applications?
Yeah, so that's an awesome question. At the very beginning, I talk about how important lifestyle is. Lifestyle medicine is essential, and I fight the battle every day to work with my clients to say what lands, what could they do. Everyone says to go exercise 45 minutes at the gym. That's hard work, but could they go on a walk around the block in 10 minutes after they eat lunch, right? So lots of lifestyle, lots of nutraceutical guidance, and then I have conventional components in there. For example, I am a huge fan of hormone optimization. I shared that experience about the nursing home. I've managed menopause for the last 10 years, and I have in my private practice, I have a huge group of hormone optimization and hormone replacement. And those are things that happen in the conventional world. They require a prescription. So Datis, this is kind of cool. Do you know that there was 50 large clinical trials looking at the use of progesterone after a traumatic brain injury? Because progesterone is so GABA, it's such a GABA agonist and it just calms the brain. So I get so excited about that. People who've had a head injury and they can't sleep and they have anxiety, optimizing their hormones with progesterone, mind-blowing intervention. It helps so well.
Right. So what are some of these big gaps you're noticing between what's been published and not really being applied like that?
There's massive gaps. The best example I can give you is in omega 3s. Omega 3s were the rage 20 years ago. There was studies galore, huge clinical trials in cardiology talking about omegas, and you never hear about them anymore. Now there's a new love of the latest statin or the latest medicine, Camzyos, and the newest Entresto and the blood pressure. Those things have faded away, and the problem is Every single cell membrane of the human body is a phospholipid bilayer. And if you replace that bilayer with junk fats in the American diets, your cell membranes don't work anymore. That means the receptors are damaged, the way they sense the surveillance in the environment, the way they communicate with your immune system, you're screwed. So why don't we use a lot of omegas to help improve the neurological functioning of the brain or cardiovascular disease? Those things have been lost. So in the conventional world, the hype is on the latest approval. The best example of this is look at the new drugs that came out for removing amyloid beta. None of them work. They
Yeah.
suck. The medicines completely suck. And I've never recommended it, never will. But that got all of the hype in the neurological world, and the things that actually work, they've been lost. We have a short
Yeah.
attention span in medicine. We don't even pay attention to that stuff anymore. It's a disaster.
So what are some holes you're seeing as a clinician that the functional medicine community, alternative medicine community is not really addressing?
Well, I think one of the things that when you try to define functional medicine, the way I viewed functional medicine 10 years ago is I just give a supplement instead of a prescription medicine, right? So I think that's a weakness. I think in the functional medicine world, we pat ourselves on the back when we prescribe the best supplements. And I've really taken a step back from that. There was a time I was heavy in supplements, and don't get me wrong, I still use them. But I worked at a naturopath office for a period of time. And every patient that came into that naturopath office got this list of all of these supplements that they should be taking. And it was the same friggin' list, right? I mean, everyone was taking the same thing, and it was this huge amount. And when people did better, I said, what made them better? And they would say, because some people get better with that approach. And they're like, well, they took the supplements. And I'm like, yeah, they took 25 supplements. So do you expect them to take 25 for the rest of their lives? Like my approach is say, let's identify a problem and let's give 2 or 3 interventions and then remeasure. Let's reconvene. Let's talk about this. A great example of in this particular naturopath office, I had a lady that came in and I said, hey, nice to meet you. What brings you in today? And she says, well, I think I have parasites. And so I want to know what your thoughts are about parasites. And I'm like, oh, okay, well, cool. Well, what makes you think that? And she said, well, someone told me. And I'm like, oh, well, let me gather some history. Let me understand your health. No GI problems, no chronic complaints about abdominal stuff, ate a very clean diet. And so I said, well, maybe you have parasites, but have you ever had a head injury? I mean, it totally looked like dysautonomia. All these symptoms were kind of dysautonomic in nature. And she said, oh, well, yeah, my senior year of high school, I was in a terrible auto accident and I couldn't go to college for 2 years. I spent 3 months in a hospital rehab center and then I came out and I did OT for like 2 years.
Yeah.
And I'm like, wow, well, that's contributory. That's why you have this chronic fatigue and all these symptoms. And she's like, well, that was a long time ago. And I'm like, hey, post-concussive syndrome can last forever.
Yeah.
So let's approach this. And here's the interesting thing. Fasting is all the rage. She was doing intermittent fasting and she would wake up with this wicked anxiety every morning. And she's like, my husband's a dentist. We have money. My kids are good kids. I have no reason to have this horrible anxiety. And I wake up and I'm in a panic. So that day, I put a continuous glucose monitor on her arm. I'm like, let's see what your morning blood sugars are. 2 days later, I get all these frantic telephone calls because her blood sugars are in the 40s, right? And then 40s and 50s. And she's intermittently fasting until 2 o'clock in the afternoon. And I thought, oh my gosh. Okay, so your question, I'm long-winded. I got to back up. Your question was, what are the holes? We can't just throw supplements at people. We have to figure out what is going on. And that's what I've tried to do in this gal's case. Putting a continuous glucose monitor on her arm completely changed her life, and there wasn't one supplement involved in that.
Yeah.
And when she came back, she was all ears. Trust me, she will never leave me. She hangs on every word I said because in that one simple interaction, we figured something out. So now she no longer comes in and says, I think I have this problem and I want you to test for it. She now comes in and says, Randy, this is what I'm experiencing. What do you think? How can we work on this? What's our next step? She's so motivated and so engaged to try to get better. And we're miles ahead of where we would have been had I just thrown supplements at her nonstop.
Yeah, and I think this is a big problem in the functional medicine community, just to add to what you're saying. I think when you look at people that are very new in functional medicine, they have the shotgun approach of, I'll just give them all the supplements, one of them is going to hit. And you actually can like see a patient's notes from the other practitioner. And if you see this huge list and very little effort to try to figure out what the mechanism is and address that mechanism, you know that they're very new and inexperienced in functional medicine. And the really top level people are doing things like you are, trying to find the mechanism first and really understanding what those are, and then having a strategy to go after it. So I think that's really important about how you teach and the direction I think we're hoping people that are trying to learn functional medicine at a higher level are going towards. So that's really good. Now I can also say something to add on to what you were saying also. For me, like I've never had a preference. I just wanted to treat chronic people. I had family members that was sick when I was growing up, and I just want to treat chronic disease. I happened to get into autoimmunity just because people were sick with autoimmunity. I never had a passion or love for neurology, even though I invested a lot of time into it. And it was only because I had so many patients that had neurological issues that were not identified. One of the key things that I think that is such a big problem is what you mentioned is TBI, traumatic brain injuries. And there's so many people that have TBIs that have effects years down the road. And I know in your course you have a section just on TBIs and you talk about it in those relationships as well. So how many of these patients that you think are just being missed in like the typical functional medicine office, conventional medicine office that have all these diverse symptoms, they're now on 25, 30 supplements, may actually have a TBI? What
Oh
number?
my gosh. I swear to you, it's 100%, right? I am so
Yeah.
biased, but
Yeah.
you, Datis, the brain is just this conglomerate of immune system cells wrapped around nerves. And when you piss it off, the example I give people is think of a beehive. If you pull out the honeycomb, there's bees crawling all over it, and they're not angry. A beekeeper can just go gently wipe them off and harvest the honey, and everything's okay. But if you walk over and kick that beehive, man, you're toast. And that's what happens in the brain. I think a huge percentage of people have unresolved um, neuroinflammation from historical head injuries, and they don't even realize it. They have
Right.
no idea. It leads to early menopause because there's pituitary damage. And so the whole HPA axis gets screwed up. It totally goose up the gut so that people now have all the dysautonomia and gut problems from that historical TBI. So in my history, when I'm talking about this, I ask people, I used to say, tell me about any head injuries or concussions. Now I say, tell me about the last time that you hit your head, or tell me about the 3 instances where you hit your head the hardest. Because people are accustomed to thinking if I didn't lose consciousness, or if my MRI didn't show a brain bleed, I didn't have a concussion. And
Yeah.
instead, you get them to start thinking, hey, each one of those head injuries could have primed those microglia, could have turned them from their state of surveillance into a state of active troublemaking, right? So yeah, I think there's a huge percentage of people that are running around with post-concussive syndrome, and they masquerade as I've got depression, I've got anxiety, I've got attention deficit disorder, right?
And I think when practitioners like see the topic of your course and they see neurodegenerative diseases and neurological disorders, in their mind they're going, I don't really have those patients. I really have fatigue patients and depressed patients and gut patients. But like as a clinician, you really have to hone your skills on how to figure out these patients that actually have TBI and have neurological issues. And I think if you don't, you're just going to have a large percentage of patients you're going to fail on. And it's like once you
Oh,
make a connection, it's so important to just hone in on it.
yes, I don't know who said this, so, and I can't quote someone, but it stuck with me in one of my training. Symptoms of a disease are the disease. Okay. And so when patients come in and they say, "Gal, I'm having word finding problems. I can't remember anyone's name, or my memory isn't very good." I never say, "Well, what do you think that's Alzheimer's?" Because they'll say, "Well, I don't have Alzheimer's disease," because they project it as the end stage of the disease.
Right.
But they probably have the underpinnings of that disease because they have the symptoms, and the symptoms of the disease are the disease itself. So we would never say to a diabetic, oh, your blood sugar is 250, but you're not diabetic. Elevated blood sugar is the disease. And in my opinion, people who have refractory mental health issues, people who have chronic memory problems, they may not have advanced Alzheimer's disease, but they have the underpinnings. And if they start now, they do so much better. There's been neurologists that say this is the first generation that gets to choose whether or not they get Alzheimer's. Like it's a choice. And it's because the way that we live our life is a huge predictive element as to whether or not we get the disease. So yeah, sometimes I think I did our group a disservice because I called it, steps to neurodegenerative disease, and they instantly tune out. I don't deal with dementia, so screw it. I'm not listening to what Vawdry has to say. Well, my thought is, hey, give me a chance. Let's walk through this because there's a good chance that all of your patients have these underpinnings and they just don't know it. No one's teaching them that.
Right. And even further, I would say every one of us has a neurodegenerative disease in the making. We're all
For
being
sure.
runs at a certain population every single day. Just how fast does it go and how much does it express itself? It's something that, everyone has to really consider strategies for. Now, from the information you're teaching, how much of it do you think would apply just to like your loved ones and family members and just the preventative stuff? Maybe they're not, let's say they don't have acute symptoms. How does your course address those things?
Yeah, well, I've tried to structure it from interventions that patients can do themselves all the way up to interventions that would require a prescription. And there's a whole timeline in between. So the lifestyle interventions to nutraceuticals to testing that some people can get even without access, direct access lab testing to, oh, I got to see a healthcare provider. I think it's all applicable. But you brought up a dilemma. And that dilemma is that our society totally doesn't understand neurodegenerative diseases. You said it, we all have some neurodegenerative disease in a way because I'm in my 50s, right? So I'm just getting older as time goes on. I'm not Benjamin Button. And so things are going to eventually fall apart. I get that. The problem is that people have these disease elements, these symptoms, if you will. And because it doesn't look like the assisted living center Alzheimer's disease wearing a diaper, sorry, that sounds disrespectful, but because they're not wearing an adult diaper and having someone feed them, it's not Alzheimer's. Well, where do you think that started? That started with, I used to be able to balance my checkbook, but I hate QuickBooks now. It sucks. I can't remember anything and I don't want to learn new software. Dude, that's the underpinning right there. And so for loved ones, the tease, I'd be a gazillionaire if every woman that came to me and says, I want you to talk to my husband, or my husband says, hey, talk to my wife. The problem is their partner doesn't think there's a problem. What I hope eventually happens is the stigma associated with neurological disorders fades away. And people can openly say, dude, I'm in my 50s now and I need ADD medicines. Right? I don't remember things like I used to. A couple of years ago, I'm working urgent care. And my rhythm is I always look at the chief complaint of why they came in for a visit. I look at all of their medicines and their vital signs. And then I go see the patient. It takes me 30 seconds. I can quickly look at everything and I go see the patient. And this Christmas break, like 2/3 of the people that I'm seeing were on Adderall. And I was thinking, my gosh, what's going on? And so I'd go in and I would say, well, tell me a little bit about your history. And they'd tell me while they're there. And I'd say, hey, I noticed that you're on Adderall. You taken that your whole life? No. I graduated summa cum laude from my graduate class. I've been an accountant my whole life, but for some reason, I just can't stay focused. And I'm like, does that ever bother you? And they're like, I don't know. I mean, everyone else is on AD. I thought I tried it. It actually helped. And I'm like, oh, okay. Well, if you ever want to kind of talk through why that might be happening instead of taking a stimulant, holler at me. And then I'd leave. And people would say, well, do you think there's something that you can do? I'm positive there's something you can do, but I can't do it in a 10-minute urgent care visit. And I don't know how motivated you are to kind of adjust some of your lifestyle things because
Well,
you have more control of it than I do.
yeah. Well, those are all really, really common things that we all face, and they get ignored, and patients don't make those connections. And I think a lot of practitioners don't make those connections well. Now, when I was looking at your course, you have like infections, autoimmunity, concussion, toxicity, insufficiency syndromes, vascular disorders. You go into this whole array of things. What was your favorite topic to teach in your course?
I love the topic on metabolic health. And the
Okay.
reason I loved that is there's so much practical things that you can do. Every single one of my clients needs a continuous glucose monitor on their arm. That is the greatest intervention that a healthcare provider can do for every patient, regardless of whether or not they're diabetic. And I've given a million slides, a lot of slides. I just clicked through them that show them here's what it looks like. Here's how you sync it to your phone. Every naturopath watching this needs to make this a part of their practice. Dexcom just released an over-the-counter continuous glucose monitor that doesn't even require a prescription. It's called Stelo, and it just barely came out. You can buy it on Amazon. Every single patient needs guidance in walking through that. So I love the metabolic lecture because the world classifies healthy food in dogmas. Well, I eat healthy because I'm a vegetarian. Well, I eat healthy because I'm keto and I'm carnivore and I'm South Beach and I'm low carb and I'm bodybuilder.com, whatever. Those aren't, that's not a definition of health. A definition of health is how food affects you. And
Right.
so if I put this continuous glucose monitor on and I eat a baked potato and my blood sugar goes to 300, then I'm not sure that a baked potato is the right thing for me to be eating every day. That doesn't mean that they're bad or unhealthy, but it means that metabolically something is not working in my body. And so I shared that example of the lady that put on a continuous glucose monitor. It changed her life. So I love the metabolic lecture. It's
Right.
awesome.
Yeah, and continuous blood glucose monitors for sure have become one of the most powerful ways to evaluate patients. And just it's
Huge.
like someone will eat the same food and have a completely different response than someone else. And some of the things that people think are low glycemic may not be for them. I mean, they just have their own unique response to it. And it's like mind blowing when you start using on in your
Yeah, I
practice.
had a group of executives that came to Idaho and we did a boot camp for brain health, right? These executives are at the top of their league. Most of them make 10 times more money than I'll ever make in my lifetime. They're super wealthy and super motivated to figure out how to stay on their game. The day they come in, I sit them down, I put a continuous glucose monitor, had them sync their phones with it, and then I fed them every day. I asked them specifically, don't snack during my summary because we want to watch and see what your blood sugars do as a group. And then I'm going to feed you lunch and we're going to see what your blood sugars do 15 minutes. And then after lunch, we're going to go on a 15-minute walk and look at our monitors. So this entire week, we were going through this. They ate the same food. They were generally the same age, and their blood sugars varied between 100, somewhere between 20 and 120 points of milligrams per deciliter blood sugar. So they ate the same food, and one person's blood sugar would go from 100 to 120, and the next person would go to 230. They're eating the same freaking food, right? And so it's mind blowing. People got to do it. It'll change their lives, change the
Right.
way they view health.
So, the goal for me with these master classes is to bring in clinical experts and have conversation in a sense, or a presentation in a sense, where like when you're at a conference and in between the conference speakers, you speak with an actual clinician and go, just tell me what you're actually doing. And I think you've delivered that really well. And I think you've done it in a really masterful way. And I really hope people really take advantage of the brilliant course that you've developed for them, and I'm sure they will benefit themselves, their family members, and they'll start to see patient populations that actually have neurological conditions that they don't even know exist. And then for those that have neurological conditions, practitioners are always overwhelmed with the brain. I think you broke it down in such a great way where they have like action steps, step-by-step approaches to take and really work through the case without it being so intimidating. So I really want to thank you for sharing your wisdom and your clinical approach to our community, and really want to thank you for that, and I hope a lot of people, are smart enough to take advantage of this class.
Oh, Datis, it was an absolute dream come true to be able to speak on the platform of Kharrazian Institute. I'm so grateful. I feel like it was a blessing, and I gave my heart and soul. So I'm hoping that people watch it and they can feel some of the energy and the passion that I have for brain health. And I hope it's contagious.
Awesome. Thank you so much, Randy, for your time and for all the stuff that you do.
Thank you.